Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kapomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. So, we are here today with another pharmacist. Actually, you are our first I call it full-blown whole pharmacist because I've had a few interviews with lovely pharmacist students. Some are closer to graduating than others. But you're my first actually practicing pharmacist. So I'm excited to get that perspective as well. But without further ado, here with Gloria, I'm going to have her introduce herself and we will get started from there. So, Gloria, welcome to Healthcare Boulevard. Tell us a little bit about yourself.
Hi, thank you so much for having me here. Again, my name is Gloria Adu, and I am a pharmacist. I work currently with Tower Health Network in Pennsylvania, and originally from Ghana, West Africa. I'm a proud African, and I've been living in the US for quite some time. Maybe it's time to go back home. I don't know yet. But I've been in healthcare for almost all my adulthood. I was a pharmacy technician actually at LAC USC Medical Center. And from there, I decided to go to pharmacy school. So I went to Ohio and went to the University of Toledo. And after pharmacy school, I actually went back to California and started working for Kaiser Permanente in Fontana. And after a few years, I wanted to go back to the East Coast. I guess I like the snow. So I came back to the East and I've been here in Pennsylvania for a couple of years now. So in a nutshell, that is who I am. And thank you for having me.
Of course. Wow. So you were in Cali. How long did you stay in California for?
My family actually, when we moved from Ghana, we were in California, in
Oh, I see. I see.
Corona, California.
Oh
So
yeah, that's not far
yeah,
from. That's like 20-minute drive from where I'm at. That's wild.
yeah. So I was there for a while, and then the East was calling. So
That's wild because I did the opposite. My family is in Maryland.
okay.
And I stayed there until PA school, and then I moved out here. I purposely applied for like warmer climate states.
Ah.
And now I'm like, graduation is over, and I'm like, wow, I guess this is what it is. Sunshine.
That's it. I know California is it's nice, but there are reasons where we live in the East Coast.
No, I totally get it. There's plenty of reasons to choose East Coast over Cali. I cannot argue that. It's just depending on where you are in your lifetime.
Yeah.
There is no like guarantee. I can say forever that I would never leave Cali. I cannot say that. But for now, if it's
Cali's good.
yes, for now.
Yeah.
But no, that's interesting. Thank you and welcome to Healthcare Boulevard. So how long have you been in your current position?
Currently with this health network, I've been here
Mhm.
for 5 years.
5 years. Okay.
Yes, I've been here for 5 years. Yes.
And would your position be described as clinical pharmacist?
I am actually a clinical pharmacist over
Okay.
there. Yes.
Okay. And have you held other subtitles to pharmacy before this? Like, or have you
So
always
in
been clinical?
pharmacy, usually you have the regular staff pharmacist.
Okay.
So they basically any like retail pharmacist will be staff pharmacist.
Okay.
When you go to most hospitals, it depends on how the hospital is set up. But
Mhm.
most of the pharmacists in the hospital are clinical staff pharmacists or clinical pharmacists.
Okay.
So when we say staff pharmacist, that means So then I have to explain what pharmacy is all about.
Please.
So usually when you say, what does a pharmacist do? So we have pharmacy in different forms. So when we talk about retail or community pharmacy, that's when we talk about the CVS, the Rite Aids, and the Walgreens. So those are community pharmacists. So when a physician writes or a doctor writes you a prescription, you just take it to that pharmacy. The pharmacist looks at it, fills it for you. That is retail or community pharmacy. Then you go to the hospital setting where there are inpatient pharmacists also there working in the pharmacy. So their job ranges from also just filling the orders that the physicians place for the patients that have been admitted. And also they actually make, mix, and compound IV drugs, like intravenous drugs that go straight into your blood. So that's also the job of the hospital pharmacist. So then we have compounding pharmacies where they actually make certain medications that are not available commercially. So they have to actually make it for you. And the same compounding pharmacies also tend to make medications for like veterinary medications for pets and stuff. So there's other forms of pharmacy, but I will not go deep into it. Some people work in nuclear pharmacy where they make radioactive pharmaceuticals. Others work in the actual drug companies where they hold various positions. And so there is some work in the industry also, meaning your insurance company will have pharmacists there that actually look and see if the medication that the doctor wrote for you is actually good for you or whether there's a cheaper alternative. And so those are called prior authorization pharmacists. So there's so many different, when you look at pharmacy, there's so many avenues that people can go into. So we all work like differently. So coming back to my position, I'm a clinical pharmacist. So what we do in the hospital is not just staffing, meaning just filling the orders that the doctor places. We actually look at the patient and check to make sure that whilst they are in the hospital, everything that the physicians have ordered matches that patient. Because you should look at yourself, when you come into a hospital and you come in, let's say, with a heart issue, the heart doctor is going to see you. Sometimes maybe there's a little bit of breathing issue. The breathing doctor is going to see you. Nutrition is going to see you. Kidney might see you. So everybody is trying to look at you and help you out. So pharmacy will look at all the other interdisciplinary units, what they are doing, and try and make sure that they are ordering the right medications for you. Because here comes a physician that is for the heart. They will just order a medication. They are not checking to make sure that your kidneys are working well. So this is the place where the clinical pharmacists come into, and we make sure that the whole picture of the patient is good for the specific medication that is ordered. So we tend to intervene a lot with the physicians, nurse practitioners, PAs, and we tend to do that a lot to make sure that they are ordering the right thing for the right patient.
Okay, so is your are you coming in after the prescription or during, or is it before the prescription?
So usually in the hospital setting, the physicians, PAs, nurse practitioners, or even the nurse themselves will put the order into the system. So the pharmacist, the order will come to the pharmacist. So until the pharmacist verifies that order, that it's good, usually you cannot give it to the patient. So the medication is ordered, pharmacist sees it, we look at, is it the right medication for the patient based on whether they're a woman, whether they're a man, based on their renal function, based on the disease that they were actually admitted for. So we have to look at all that. And then if it's good, we verify it, and either the nurse can take the medication off of the floor or we send it to the nurse. So yes, they have to put the order in before pharmacy sees it, and everything is electronic. So the moment they place the order, we see it and we verify it. Yes.
Okay. So what do you like most about your specialty in pharmacy, your work setting?
My work setting.
Mm-hmm.
So with my work setting, what I like most about is when we are able to intervene,
Mm-hmm.
because we have to look at it in the sense that the nurse has like 5 patients that they are taking care of. The doctor has about 30 patients they are taking care of.
Mm-hmm.
So they are actually the face that the patients see.
Right.
We are support to them. So sometimes a physician or a doctor will put in an order, maybe even meant for a different patient.
Mm-hmm.
But in the heat of the moment and how fast they are going, they
Mm-hmm.
accidentally place that order on a different patient. So the most satisfying part about our job is to be able to see these things. So let's say it's a male and they ordered like Provera for this patient. It's a hormone for women. So the moment I see that, I'll have to call the physician and ask, hey, this medication was ordered for a male. Is there a specific reason?
Mm-hmm.
So most of the time, I'll be like, oh, it was meant for patient in bed 2, not bed 1.
Mm-hmm.
So that when we are able to intervene, that is what gives us the sense of satisfaction that we are really, really making an impact in healthcare. Number 2, in the hospital setting, when we are able to get patients discharged quicker, it actually saves a lot of money,
Mm-hmm.
because the longer the patients are in the hospital, the sicker they get, because it's a hospital. That's where all diseases, nosocomial infections come in. So most of the time, we want to get the patients in and out effectively, out quicker. So when they come in and we are able to help with drug therapy, and they are discharged and the patients feel good, it's actually a win-win for the organization.
Mm-hmm.
So when pharmacy intervenes appropriately, we are able to cut costs for the health network. So that also gives us that sense of satisfaction there. So I would say those are the 2 main things that gives
Mm-hmm.
us
And
satisfaction.
on the flip side, what is or are some of your not so favorite part of your job?
Whew. Okay. So as with every good thing, there is good and there's bad.
Yes.
So some of the thing is the stress of it.
Mm-hmm.
Sometimes there's a lot of stresses with pharmacy, because I said it. One nurse has 5 patients. One physician has 30 patients.
Mm-hmm.
The pharmacist could have 150 patients. So that alone can put a lot of stress on you. And most people don't know that there's a lot of detail that has to go into the pharmacist work.
Mm-hmm.
Because if a physician writes for a medication and I miss it, and the nurse gives to the patient,
Mm-hmm.
medication errors are on the top 10 causes of death in the United States. So
Mm-hmm.
you feel this sense of guilt and pressure on you to make sure that you are not messing up.
Mm-hmm.
So that is one, the stress of it is what I don't like about the job at all. The stress,
Mm-hmm.
yes.
In that same sense, what is currently and maybe since you've been working, what has been your schedule like? Has it been Monday to Friday, or have you done some night shift? How is that, especially as it balances with your life?
So usually with our work schedules, it depends.
Mm.
So I have gone through several health networks, and pharmacist schedule just depends on where they work. So
Mm-hmm.
with retail section, I used to work retail on the side just to keep up my knowledge. It just depends. Some people are 12-hour shifts, some people are 14-hour shifts, some are 8-hour shifts. It just depends. Right now at the hospital that I'm currently at, we have people that are 8-hour shifts, people that are 14 hours,
Mm-hmm.
people that are 12, and others that are 7 on, 7 off. So that just depends on where you are working. So there is a little bit more flexibility in what you pick, but majority of the time it is straight 8s, which is
Mm-hmm.
8-hour shifts. And with healthcare, you always have to work weekends. So if
Right.
anybody tells me they work and don't work weekends, I want that job, because anywhere you go, you will have to work weekends. So
Right.
that
Right.
just goes with healthcare. Yeah.
Now, how much are you able to essentially pick, not pick your own schedule, but choose, you know what I mean, like based on your lifestyle and based on what responsibilities you have at home and things like that. Say you were working full-time, and at some point, do you have the option to go part-time if you choose to?
With my hospital, usually you have to sort of wait
Hmm.
till they have an opening. So with that, it all depends on which health network you work for, which hospital. Because my previous hospital, it was pretty easy. If you need to step down, you step down. And that was because they had a lot of per diem people
Hmm.
literally waiting to get in.
Mm.
So if you want to step back, they would definitely allow you, because they already have somebody to replace you basically. So
Mhm.
that is just based on where you work.
Mhm. Mhm.
Yes.
Okay, that makes sense. Now I'm gonna roll it back a little bit to while you were in school and before that, and ask you, what route did you take in your education? Did you get a bachelor's degree? Did you take community college? What was your educational journey like?
So when I came in, I already knew what I wanted to do. Like
Mhm.
when I moved to the United States,
Mhm.
back home in Ghana, you are basically steered towards what they think you can do.
Mhm.
So in high school back home, they literally tell you what you are going to become.
Mhm.
So my choices from high school basically was architecture, engineering, and pharmacy based on what I did in high school. So,
Mhm.
you know, African girl, we have this notion that engineering and architecture is a man's job. So then I was just left with pharmacy. So when I first moved to the States, I already knew that I was going to into pharmacy. So I basically started off with pharmacy tech. So I was a pharmacy tech whilst taking my prerequisites at a community college. And
Mhm.
I'm glad I did that, because that saved me 2 years of student loans. And
Yeah.
you know, California's community colleges are very cheap. So it was perfect. So
Mhm.
I did 2 years at a community college, and then I transferred into my school at the University of Toledo. So that was a 6 year straight program, with the last year as all year round. So
Mhm.
instead of 8 years, they kind of squeezed it into 6 years for you. So after the first 4 years, you are able to graduate with a bachelor's in pharmaceutical sciences. So I actually did graduate with a bachelor's in pharmaceutical sciences and a minor in chemistry.
Mhm.
And then you continue with your last 2 years of pharmacy school, and then you get your doctor of pharmacy degree. So yes, my school did allow us to go that route where you can graduate.
Mhm.
But most of the pharmacy schools around, if I'm not mistaken, only some schools only accept people who have their bachelor's degree already. But there is
Mhm.
a lot of programs that are 6 years also. So directly from high school, you get in, and it's a 6 year program.
Mhm.
So it just depends on what you, the individual, wants.
That's interesting. And this is part of the reason I love doing this is I'm learning more and more about these professionals as well, because I didn't know that was pretty frequent. The last interview I had, she's on the same path where she went straight from high school to
Yep.
um
Pharmacy.
yeah, to pharmacy school, and it's like 6 year
Straight.
from high
Mhm.
school, 6 year, but for her you don't have anything in between. Like if you don't finish, you just come out with
You're
nothing.
done. Exactly.
um
That's the scary part. Yes.
yeah,
Yes.
yeah, so it's really interesting hearing that those are not like totally like rare, but that is a solid option for anybody willing to take that option.
Yeah.
um and were you okay? Yeah, I wanted you to talk a little bit about the roles of a pharmacy tech, if you can.
So pharmacy technicians basically work under the supervision of a pharmacist.
Mhm.
So usually in a hospital setting, the pharmacy technician will be the one that after the pharmacist has verified the orders and the labels come out, they fill the order. So let's say we need to make an IV solution for a patient. After the label comes out, the pharmacy technician is the one that grabs the label, gets the bags and the drugs that they need, and then they mix it. And then the pharmacist checks it before it goes. So basically, they are there to support the pharmacist into actually hands-on mixing, pulling, compounding, and then they also do the delivery of the medication. So when it's done, because as I said, one pharmacist can have 150 patients that they are taking care of. So somebody has to go to the nursing unit to go and give the medications to the nurses. Also, most hospitals have adopted how do you even cells, like it's like a what's the best name to call it, we store medications in the nursing units.
Okay.
Because as you know, there's over 10,000 medications. We cannot be going to the nursing stations every single minute they need something. So the drugs that are commonly used are already stored on the nursing unit. So we need somebody to refill those cabinets so that the nurses can easily just grab the medications from there. So the technicians also do that part.
Okay.
And but when you go to the retail or community settings like CVS and stuff, when you first go and you drop off your prescription, it's actually the pharmacy technician that's going to greet you and take your prescription. They put it in a computer, fill it, and then the pharmacist looks at it, checks it, and then counsel you. So they are there as a support system for the pharmacist. Yes.
Okay. Would you say that position that you held was helpful in your education as a pharmacist once you go to pharmacy school?
So I think it did help because by the time I was in pharmacy school, I knew all the names of the drugs. I was curious, so I will ask my pharmacist questions upon questions. So I was willing to learn. So that actually did help me, because when we are talking about a specific medication, not only have I heard it, I've seen it. And so I also know how how common it is. That means it's widely used. So that kind of piques your interest as a student to want to know more about the drugs that you're actually working with. So it really, really did help. I didn't have to study the top 200 drugs. I already knew them. I didn't have to learn the trade and generic names. I already knew them from working as a pharmacy tech. So that part made it easy, because whilst people were trying to learn the names, I was already ahead trying to learn something else that pharmacists do with that drug. So yes, it did help. It did help. Yes.
And what is essentially is the education route for pharmacy tech specifically?
So the pharmacy techs, it depends. California is a little bit stringent that the pharmacy techs are licensed. So in California, I had to go to school for that. I actually went to American Career College in LA for it. And it's about, was it like 8 months or so? So it's less than a year. But in other states, it's not. Actually, in Pennsylvania, you learn on the job. So it depends on the state that you are in. So California is more strict. So you go to school for it.
You go to school for it. Okay. All right. Thank you so much for that. Because I know pharmacy tech, pharmacy, it's always something good to know, to differentiate and know the role of each one of those professionals, essentially. Did you work while you were in pharmacy school?
Oh, yeah. I had to, yes. So it depends. Some people are fortunate and they have parents who will fund their education. Other people, not so much. So I did not want to have so much debt. So I decided that for my living expenses and stuff, I had to pay for it. So yes, I did work through our pharmacy school. Depending on my schedule, depends on how many hours a week I would work. Some weeks when I had a light schedule, I could work in upwards of 32 hours, working most of my hours on the weekends so that I'm not so stressed on the weekdays. But if my schedule doesn't call for it, I just don't work that much. If I have exams coming up, I will reduce the number of hours that I work that week. So yes, I did work average of 20 or more hours every week, depending. Yeah.
Okay. Yeah. And did you go to residency or what's the other one? Fellowship
Fellowship.
after
No,
graduation? Okay.
no, I did not. Only
Okay.
because when I first graduated, there was a shortage of pharmacists
Hmm.
to the extent that they were offering cars, offering outrageous sign-on bonuses
Hmm.
that any young professional will make that mistake and not go for a residency. So I happen to be one of those people who made that mistake and didn't go for a residency. Do I regret it now? Yes. Because of the way the job market is for pharmacy,
Hmm.
it's a good thing to have. But
Interesting.
looking back, did I make the right choice? Yes, I did.
Mm-hmm.
Because if I compare where I am now, even if I had done a residency or not, I will still be where I'm at.
Yeah, you are right
Will
now.
I advise new grads to do a residency? Absolutely. Because now you will never be able to even get a hospital position without a residency. So
Interesting.
yes, I will advise for anybody graduating now to
Mm-hmm.
definitely consider residency.
So residency is not much of an option per se as it is for certain professionals like PA, as much as it is like okay, it's essentially a requirement to be fluid and have access to all the positions out there on the market for a pharmacist.
Yes,
Okay.
pretty much. So it's not a requirement, it's not
Mhm.
mandatory, it's not
Right.
part of the curriculum, but it is something that would help because I have one of the at our job we all have like mentees. So I
Mhm.
mentor someone at the work who is much younger and newer pharmacist, and she was looking to relocate to another position, and they actually based on her residency, if she had done a residency she would have gotten a much higher pay.
Mm.
Because she didn't do a residency, they were actually not like compensating her for what she's worth.
Mm. Even
So
with
I,
the experience.
even with the experience, yes.
No.
So she's just 3 years in now.
Okay.
So 3 years is actually equal to 1 year of residency. So
Really?
why they wouldn't give her the raise or the pay rate, I don't know why, but they
Mm.
use that against her. So for
Mm.
anybody starting now, unless the person is sure that they just want to do retail for the rest of their lives,
Mhm.
it's advisable to really, really do a residency, or else you might not enjoy your career.
Mm, well, thank you for that. That's a good way to put it. Um, and another question for you: if you were to switch specialties, so you are a clinical pharmacist now. Say you want to move into maybe neuropharmacist or cardiopharmacist. Do you go back, or what's the move for that?
Okay, so in the pharmacy profession track, for those who have done a residency, so they have the residency year one, which is
Mhm.
general practice. Some people opt to do residency year two, which basically you can call it like a fellowship, but
Mhm.
usually pharmacy fellowship is in the pharmaceutical companies. In the hospital setting, they just call it PGY2, where you specialize in something. So we have transplant pharmacists, oncology pharmacists, infectious disease pharmacists, critical care, pediatrics. Like you can do a second year residency and specialize in one of these areas.
Mhm.
And then when you are looking for a job, you can apply for that kind of positions.
Mhm.
Some people can get lucky. You can just do that PGY1. And then when you get hired into your job as a regular clinical pharmacist, if there is an opening for that specialist position, and that was, you can get lucky and can basically just move into that position. So it all has to do with where you work,
Mm-hmm.
basically favor also. Like
Mm-hmm.
I have to point that out. Yeah. And that's it. So I know people who didn't even do a residency that were able to move from staff pharmacist to clinical pharmacist. Now they are clinical pharmacy specialists
Mm-hmm.
because with the experience and you've worked and that organization knows you. So they already know you can do the job. So you can move into a position like that. But to move to another hospital as just regular pharmacist to get a specialist position, that would be very hard.
That would be
Unless, yes, that would be very, very hard. Yes.
interesting. Okay, thank you. And the fellowship and residencies are started after you
Pharmacy
pass
school.
your licensing test. So I understand you guys have two licensing tests, right? So you start your residency after those tests?
No.
Oh.
So usually they graduate in May.
Mm-hmm.
So you graduate in May. Most of the time, you already know where you are going for residency.
Mm-hmm.
So most people will start July 1st. So it depends on you. So most of the residency or the hospitals already have their own, let me say, policy. So for my hospital right now, you have 3 months when you start your residency to obtain your license. So they do give you time to obtain
Mm-hmm.
that license.
Mm-hmm.
So some people have it before they start, others don't. So when the residents come in, we initially we sort of train them like as a graduate intern. So we train them as a regular pharmacist for a while. And by that time, they actually start their rotations. They would have gotten their license by then.
Okay. All right.
Yeah.
And as far as you know and have seen, what leadership positions are available for pharmacists?
So within pharmacy, there is different positions that can be available. Obviously, director of pharmacy position can never be anybody who is not a pharmacist.
Right.
So that's one leadership position that is available. There is also director of clinical services. In the hospital, we have to have something called the PNT, Pharmacy and Therapeutics Committee, because we have to make sure that we are not just giving medications that are not good to people. We are not just using people as guinea pigs. So
Mm-hmm.
there is that committee and IRB committee set there also so that we make sure that the hospital doesn't do these things. So the clinical, the director of clinical services usually takes care of that. They take care of the residency program and they take care of all the clinical programs that can be done in that hospital. So that's another leadership role there. Most hospitals also have their IV room specialist, in the sense that with IV room, that means we are compounding medications and stuff. So they go through rigorous laws because I don't know if you remember, there was a compounding pharmacy in Massachusetts area where they were giving out, I think it was cortisone. They were making cortisone or something like that for spinal shots, and it was contaminated and people got hurt. So you have to realize that when you compound these medications and we give it as IV, it's going directly into the patient. So there, if you make an error, there is no way to reverse it. So the IV room goes through a lot of legal requirements. And pharmacy, that's why when we take the exams, we have the regular exam and then we have that law part also, because there's a lot of federal and state laws associated with pharmacy. So there has to be somebody to take care of all that laws and whether we are following compliant with the laws and all that stuff. So that's also another leadership position available. So there's so many different leadership and avenues in pharmacy if you want to go into leadership.
Right, right. Now, for your tests and your two tests that you have, the first one is you only take that one time, and it's national, and then the second one depends on the state.
Exactly.
Okay.
Yes,
All right.
you're correct.
Okay, great. Thank you for that.
Because the reason is state laws are always different.
Right.
So it cannot be, so the only place that you can, if you know for a fact you're going to work for the VA system or any federal agency, then you just take one state law and that's it, because you can use it anywhere you go. But for me, like moving from California to Pennsylvania, I had to take the law again. So any state I go to, I have to take their law, because law is different. I don't know why they can't just make it the same law in everywhere, but
Girl, I feel you.
it's complicated. So
Yes.
yeah.
Okay. But that is most of what questions I have for you. Before I let you go though, do you have any advice or just general advice for future pharmacists?
So pharmacy used to be my life. I love pharmacy to death. But I will be honest, I have had a very fulfilling career. I still love pharmacy. It's a very good profession. It's you're well compensated. I mean, they'll tell you a highly compensated individual. It is really worth it. But in this day and age, the market for pharmacy, demand and supply, it is not good. When I graduated, everybody was pulling you from every angle. There was so much job opportunities that it was amazing. And that told me that, wow, you picked a right profession. Fast forward to today, it is not so. So for anybody considering going to pharmacy school, my advice to you is it is still a fulfilling and great career. But if you are going to have to pay hundreds of thousands of dollars for school, I will tell you there are other options right now that are better. Physician assistant in Pennsylvania, very great. They utilize physician assistants, it's amazing. Nurse practitioner, that are other options that you can go into. Pharmacy is super saturated. So if you're going to have that much debt, it's not going to be worth it. But if you have someone to foot your bill, go for it, because you wouldn't have that responsibility of student loans, and it will be okay. No matter what they pay you, you wouldn't mind. But that would be my only advice. Other than that, pharmacy is a very great career, and whoever goes into it will enjoy it.
I really appreciate that, because I know a lot of time we can get very tethered to our profession and be like, that's the best one. And a lot of time it is the best one for us, whoever that may be, you know what I mean? That is very heartfelt out there advice, and I appreciate it, because you know we don't want young folks getting into things that they later regret, for sure.
Yeah.
Thank you so much, Gloria. I really appreciate you coming on and taking the time on this beautiful Saturday. it's
maybe at your end.
I know. I'm like, oh, it's funny over here, but I know it may not be so for you. It's really like short season. I'm getting ready to go to Vegas this weekend with my husband, just for Memorial Day, because we needed just a day out.
Yeah.
I'm excited to get in my shorts. Unfortunately, I can't tell you to do that, because I don't want you to get hypothermia.
It's cold. Oh man. Yeah.
But stay safe. Thank you so much for coming on. I appreciate your time.
Alrighty. Thank you. Have a good weekend.
You too. Bye.
Bye.
All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.